Good afternoon. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We are here on June 26, 2025 in the afternoon performing our lumbar Deuk laser disc repair. This patient travels here from Philadelphia. The Villages. I apologize. The Villages, which is actually a place where lots of people live here in Florida, in Central Florida. I think they have over 100,000 homes and probably over 200,000 people. Anyway, it's a retirement community for the most part, and this gentleman travels from the Villages to have his back fixed. And he's got two herniated discs, L4-5, L5-S1. Can I inject?
Yes.
And we need to go in and fix these with laser. He doesn't want more invasive surgery like fusion. He wants less invasive, which is why he chose to have the Deuk laser disc repair. The anesthetized shot? Right, so the way the surgery works, we're going to first start by placing a needle into the bad disc, the disc that's damaged, that's causing pain. And then we're going to bring our endoscope in, which is basically a tube with lenses and a camera shot. And it has a hollow center where I can bring a laser fiber and other instruments in to work on his disc. Shot? Alright, so the first thing I got to do is get to the disc, and that's what I'm working on right now. We're almost there. Shot? You can see the needle is right at the back of the facet. AP? If you have questions, type them up, and Henry will ask me. I'll answer them for you. In the meantime, let's show the audience the 30 different things that cause back pain. Looks good. I'm Dr. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. As you can see from the video, there are 30 very specific causes to back pain, and at Deuk Spine Institute, we are now able to diagnose all 30 causes and fix them. In this patient's case, his problem was the L4-5, L5-S1 disc. Disc injuries like his are the primary cause of back pain in 85% of patients with back pain. 85%. Let's go irrigation on. Thank you. So, let's switch over to scope. Scope on, good. Right now we're inside the disc, specifically the wall of the disc, and specifically the back wall on the left side. And you can see the wall is shattered and torn. That's what we're seeing right now. We call this an annular tear. And the annular tear gives rise to a herniation. We're going to go in and clean out the herniation. We're going to clean the tear so that his body will start healing this tear.
We do have a question.
Sure.
Coming from Lanu on YouTube.
Ah, Lanu. I wonder, Lanu,
They're
do
asking.
you miss any of our surgeries?
They're asking, are you okay, Dr. Deuk? I hope you find a good nurse soon.
Oh, I have great nurses, by the way. And to be honest with you, that nurse has done a great job for the most part. But for some reason, there was just a lot of attitude given and not doing the job properly. And, you know, let's face it, we're in the middle of surgery. We're taking care of a patient. It's not a time to argue with the surgeon. Fix the problem. If you want to argue, argue later. But when a surgeon says there's something wrong with a piece of equipment that he's using or she's using, they're usually right. I know it's hard to believe for some people, but we're the ones who use this equipment every day. As a matter of fact, I can tell you if the air conditioner is off by 1 degree in the operating room, right, Luis?
Oh, yeah.
Or the humidity is too high. We're very sensitive to those types of things. So, thank you for your concern. I appreciate it. Everything will be fine. The patient did well. Ultimately, That patient, we had to stop his surgery because, as a matter of fact, the delay that was caused by that nurse didn't help. It probably kept us from being able to fix one more disc. So it is what it is. We are limited sometimes by not just our patients, but by our equipment and the people we work with, right? All right. Well, Henry, are there any questions?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is a herniated disc causes back pain?
I think that's a great idea. Let's do that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video how it is that the injured disc will cause so much pain through a process called inflammation. And inflammation is where your body uses its inflammatory system to try to remove something from the body, usually what we call a foreign body. Many times it's bacteria or fungus, and sometimes it's something like a splinter in your finger. But imagine having a splinter in your finger, and remember, it gets red and swollen and painful and tender and hot. That's called inflammation. And if you have that same inflammation in your disc, well, you can imagine every time you stand up or bend or twist, it's going to hurt. It just causes the inflammation and the pain fibers to become activated with activities. And that's what happens when you have a herniated disc. So far, everything's going well. There's a lot of scar tissue here. I'm going to try to use the grabber to take some of the material out. If you have questions, feel free to ask. You're watching live spine surgery being broadcast from Deuk Spine Institute in Florida. By the way, next week we're going to be out. We have our holiday, but also I'll be out of town, so I won't be operating. It's going to give Henry an opportunity to catch up on some of our testimonials. We probably have about 8 testimonials that need to be uploaded.
Yes, correct.
Right? We have so many people. We've been doing a lot of surgery lately, and we have a lot of very happy patients with great results, so we want to share that with the world.
And I'm very excited to edit these videos and create and just expand ourselves. And then with the podcast, we're also going to try to get that going for next week.
That's right. We're going to be launching our podcast. Henry thinks he's going to have the introduction to our Deuk Spine Institute podcast completed Friday.
Yep.
And then he's going to have the first podcast, which we shot with question and answers between Henry and I. That's going to be uploaded to our Spotify site.
Yes, and then we'll also upload our episodes onto our YouTube channel as well, our Facebook, Twitter, wherever you follow us on our social media. And yeah, we're just very excited to going forward with this.
So you're going to have a playlist called podcasts?
Yes. Well, the Deuk Spine Institute podcast playlist, we can definitely start that up as soon as we get the first episode off the ground and release the trailer. So, nevertheless, the trailer will be finished by tomorrow.
Good. All right. So far, how's our patient doing, Dr. Berndes? Good to hear. Good to hear. This is all herniation and scar tissue. Look at that. This is not normal. So we got to try to debulk it, Get rid of it. It's way too much of it. Pressing on nerves, causing problems. For those of you who don't know, that laser fiber is 1 millimeter thick. The diameter is 1 millimeter. Yeah, I think the increased energy is helpful. At least maybe certain types of disc, it's more helpful than others. Like this, it's so thick and it just requires more laser energy to be delivered, you know? I don't know, maybe 45 is okay for other discs, but not the ones with lots of scar tissue. You can see the end plate right there, the bone on the left at 9 o'clock. That is literally the surface of the vertebral body that abuts the disc. It's called the vertebral end plate. Any questions?
No current questions, so we just got a comment from Lanu once more on YouTube saying, in Asia, the hospital culture is strict. Nurses obey the surgeon with absolute. Any nurses that talk back to surgeons faces termination. Respect is deeply embedded in our culture.
Well, Lanu, I got news for you. It used to be that way in the United States, but unfortunately we've undergone this woke kind of mentality, and unfortunately things have changed in America, and it's not for the better. But I agree with you. It should be that the surgeon, obviously this is my patient, the surgeon needs to be in control. It's really a joint effort between everybody working with the surgeon being sort of the captain, and the anesthesiologist being the other captain. So kind of two captains. One is taking care of the patient's respiratory cardiovascular system, and the other one is doing the surgery and managing, bleeding and removing things that should be removed. But it's a collaboration based on respect and an understanding of what every person has to offer. And everybody in the operating room has a job. There's nobody here just kind of standing around doing nothing. And a lot of our people have 2 jobs or 3 jobs. So they're not just managing one thing, they're managing multiple issues. For example, Jordan does the fluoroscope, but he also does the endoscope, and he also troubleshoots some of the monitor issues and helps with moving the patient and things like that. And I mean, everybody here, I could go through all the names, but the point is everybody's got multiple jobs. We all work together as a team. But when I tell them to do something, they don't argue with me. They do it. All right, he's moving a little bit more than I like. Let me know if I need to stop. He's not moving too much for me to operate, but maybe you want to just consider giving him a little more. Yeah. Maybe I need to come to Indonesia. What do you think, Landu? Should I come to Indonesia? I've never been to Indonesia, but I very much want to go. My wife wants to go. She wants to visit Singapore, actually, very badly. I think that's on the top of her list for places to visit, and mine as well. I think I would really like it over there.
Singapore is on my bucket list as well. Yeah. Been wanting to go there for forever.
They say the most advanced airport in the world, right?
Really? Singapore has the most advanced airport. I didn't know that.
Oh my goodness, I've seen videos of it. It's beautiful.
Well, I wonder where Lanu is from. Are you from, is Kuala Lumpur? Is that in Indonesia? I know there's, they have beautiful ocean and beautiful reefs over there. Corals. Can't remember the name of the cities though.
We have a lot of these guys.
Yeah. Oh my gosh. Huh? Who's Jakarta? Jakarta is what I was thinking, yeah. Jakarta. It's Malaysia? All right. Kuala Lumpur is Malaysia. There's a place that's famous for diving over there. I just can't believe I'm drawing a blank on it. Yeah, Bali's known for diving, but it's not Bali. It's somewhere else. Something that starts with an A. Like, can't remember the name. All right, we're almost done with this disc. So far, everything is going well for the patient. There's just a little bit more I want to get, a little bit more medial. So I'm really trying hard to aim medially. But remember, his facet joint, his iliac crest are all kind of blocking me. But this is sort of the base of the herniation right here. If you think about the herniation as being a mountain, it's poking up at 12 o'clock. I'm shrinking down, removing, excavating parts of this mountain.
No current questions, so we do have a comment coming from Lanu once more on YouTube saying, if you visit Indonesia or Singapore, please visit the hospitals there. You will be very impressed with the nursing staff, very disciplined and polite with excellent skills.
I'll bet. I would love to. Look at all these pieces of herniation coming out.
You can see them.
I guess Indonesia is ahead of us in time, probably, right? They must be probably at least, what, 10 hours maybe ahead of us?
I can check.
Is it more than 10? Wow, yeah. Could be.
It is, well, there's actually Western, Central, and Eastern Indonesia time. Western,
Really?
yeah, I just learned that now. Western is 11 hours, Central is 12 hours, and then Eastern is 13 hours ahead.
Wow, I had no idea Indonesia was that big.
It's,
That's terrible.
yeah.
I should know that. Yeah. Huh? Yeah. It's Friday there, right?
Technically, yes.
Wait a second. Is she watching this at like...
3 o'clock in the morning.
Yeah, this would probably be 3 or 4 o'clock in the morning where Lanu's at.
Lana, what are you doing awake at 3 o'clock in the morning? Maybe she works the night shift.
Possibly.
All right, got about 1 minute left on this disc and then we're going to be done. This is the hardest to fix, L5-S1. How much energy have we delivered?
How much? I need 34.13.
34. Still no record. Let me see if I can grab a little bit of this. Look how fibrous it is right there. It's all scar tissue. A lot of scar tissue from the chronic inflammation that he's had. A little piece of herniation. This is definitely going to be the hardest disc to fix. There are little pieces coming out, not much. All right, a little bit more. Sorry, a little bit more. On, laser. Thank you. Feeling it on my foot.
With no current questions, why don't we show the audience of how it is that we cure discogenic lower back pain?
I love it, Henry. Go for it. Thank you.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. So we just finished the L5-S1 disc. I've gotten as much as I can take out. I think I've gotten about 50% of it, which is what we really need to get a good result. People sometimes wonder, why can't you get all of the disc herniation? The answer is nobody can, because we're all limited as surgeons by the patient's anatomy. And what that means is there's structures there that we cannot take away, cannot cut, cannot remove in order to get down to the disc and repair it. So some of those structures just cannot be messed with. You have to leave them alone. You can't take them out or work around them. It's just not possible. We don't have the tools and equipment to do that. We use the most advanced equipment and tools in the world, and if you compare what we're doing to what all the other surgeons are doing, our technique is far more advanced. However, even with the advanced techniques we have, we still can't remove 100% of herniation. It's just not possible. The good news, though, is it's not necessary. It's not necessary to get the patient out of pain. Shot? No. All right. Shot? Yep. Yep. All right, fluoro out. We're on the last disc for him. Any questions?
At this moment, no current questions.
Well, let's show the audience our new video then. Deuk laser disc repair versus more invasive surgery like laminectomy or discectomy or stimulators. Alternative treatments that really don't work well. Hi, I'm Dr. Deuk Majan. We've just completed our free MRI review with Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, you, there is no need for postoperative opioids. Our patients are treated with a small 7-millimeter incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. All right, welcome back. We just showed you our comparison video of Deuk laser disc repair versus invasive surgery. That doesn't work, by the way. I don't know. This disc is one of those that just doesn't want to stop giving. It's just giving lots of herniation. So, and the laser is not getting rid of it fast enough. It's just a big herniation. I'd say more like 10 minutes. 5 to 10 minutes left.
We have a comment coming from Lanu saying, I'm Taiwanese. Taiwan was part of Japan. I came from a medical family. I get up at 3 a.m. every day ever since I was a student. It's part of discipline that is deeply rooted in our culture.
I love it. We Americans need more of that. Dr. Berndes is asking, what time do you go to sleep every day?
I'm curious on that too.
You know, there's a lot of cultures that go to bed when the sun goes down, you know? They start their day before sunup and they go to bed around sundown. Yeah, so the question from the operating room is to Lanu, and Dr. Berndes is asking what time you go to bed.
I will await an answer from Lanu, and once I do, I'll let you guys know.
All right. Come on. Huh? Thought
I believe we have a question and or seeking advice coming from Mountain Properties on YouTube.
hello, Mountain Properties?
Mountain Properties.
All right, Mountain Properties. Welcome to our live stream.
Asking, hi, I have a herniated L5 to S1. Been 7 months of PT, massages, chiropractor visits, acupuncture, epidural injections, and still no relief. I'm only 43 and wonder if this surgery might help me.
Well, you got a great question. You should not be in pain. Pain can be fixed. The question is, where is it coming from? It could be that it is the herniated disc. That's the most likely cause, not knowing anything else about you. That would be where I would guess. However, we can find out for sure if you are willing to do a free MRI review. Henry will put the link for the free MRI review below. You just have to go into the link and fill out your name and information, and we'll set up a meeting where you're going to meet me face to face. I'll look at your MRI with you, and I'll tell you exactly what's causing your back pain.
And the comment coming from Lanu on YouTube saying, I go to sleep at 9 p.m. and get up at 3 a.m. I study and research before I leave my house. My American friends don't understand. They think it's insane.
I understand. I think it's great. You're obviously driven. You have a purpose. You have a plan. You're following it, executing it. I think it's wonderful. There's nothing wrong with what you're doing. I'm American. I'm your friend, and I understand it. I applaud you for your discipline, focus, commitment. All right. Well, this disc is taking quite a long time because these are big herniations. We know that. I just cannot seem to make any progress. Just a lot of fluff here. By the way, you can appreciate just how avascular the herniation is, meaning there's no blood supply. You don't see any red. You don't see any bleeding. It's just white. White means there's no blood. There are not many things in the human body that have no blood supply, but the disc is one of them. Of course, that changes when you get inflammation in the disc from a tear. Coming out.
We have a comment coming from One Mountain Properties, once more on YouTube, saying, okay, thank you. I live in the mountains of Georgia, so not sure when I could fly down and see you. Driving that far is not going to work. My pain hurts most when sitting/laying down. I am keeping your info.
Sure. But I guess there's some confusion because we're not asking you to drive down here to see me. The free MRI review is done virtually. Will you turn up the power some more?
One second. You need to stop.
Yeah, but we have to, the energy is as high as it goes, we have to go up on the rate. So I can go down on the energy and up on the rate.
No.
No?
Has to be more rated. But
The
he needs
rate
to stop
has-
first.
Yeah.
When I need.
Fine. What is your rate?
The rate is 15.
Do it now.
We want it at 20, that'll bring us up to 70.
That's fine.
That's okay.
old is this fiber?
How old?
How old?
We probably use it maybe 7 times. Maybe.
Try to get a new fiber. Let's see if we can.
You want a new fiber?
Yeah.
Yeah.
Yes.
Yeah, I want a new
New
fiber.
please.
A better fiber. I mean, this thing is just not releasing the herniation the way I want it to. It's like barely doing anything. I don't know if it's just so much scar tissue in the herniation. This grabber is just not grabbing it out well. There, finally.
We have another question
Sure.
coming from Maximus on YouTube, saying, "Hi, hope you're all keeping well. Just wondering, with the amount of material that has come out of the disc, would this lower the space down in the disc? And if it happens again, what would the effect be?"
Yeah, great question. So we're not taking any material out of the disc. We're taking herniation out of the wall where it doesn't belong. So we're not lowering the disc at all. The disc has already come down as much as it's going to, and it doesn't matter if we took the whole disc down, all the way down to bone on bone. It doesn't cause any symptoms. It doesn't need to be treated. It doesn't cause any symptoms. There's a lot of misinformation about what causes back pain and how to treat it. And people are going around with the belief that, oh, when the disc collapses, it has to have a spacer put in there to bring the bones back apart. That's nonsense. Whoever told you that lied to you. And if 2 people told you that, then they both lied. If 5 people said that, then all 5 people lied. And there's a lot of misinformation out there right now in the world about disc problems. But if you want to know the truth, you come to Deuk Spine, you read our website. Best thing to do is go to the website and you can read everything you need to about disc problems. That's where you should get your information, nowhere else. Any other site's going to misinform you. Going to tell you things that are not true. We're the only company in the world that cures back pain. There is no other company that says, come here, we'll cure your back pain. We're the only one. The reason is because we know exactly what causes back pain, and it has nothing to do with the height of the disc or collapse of the disc. It has nothing to do with spinal stenosis. Spinal stenosis does not cause back pain. Yet people will tell you it does, and they're wrong. Let's get Grabzilla. Huh? What? Yeah. This is a very difficult disc to remove. It's You ready? I really don't like this thing. I don't like that irrigation handle. I like the black one. That's what I'm calling. That's more like it. Huh? It's all herniation. Huh? You're mumbling over there.
Said it's satisfying.
Who said that? Yeah. We call it Grabzilla. It's named after Godzilla, the apex predator. All right, that's looking much better. About 3 minutes. 3 minutes, Berndas. 3 minutes.
No current questions, but we do have a comment coming from Maximus once more on YouTube,
Sure.
saying, thank you for your answer to my question. I have definitely listened to a lot of wrong information.
Oh,
and,
yeah.
and listening to you gives a lot of people hope that all is not lost.
Well, thank you, Maximus. The fact is that I grew up in a system that told me all the same things it told you. Bone on bone, you need to fuse it, need a spacer, need an artificial disc. It turned out all of that was not true. I only figured it out when I started treating patients differently, and I found that the treatments I was doing was working, and I wasn't doing anything with their, I wasn't doing anything with their bone on bone or their degenerated disc. I was just fixing the tear in the back. And that's when I realized we're very wrong about how we're approaching back pain and fixing it. And that there's a lot of misinformation out there. All right, I think we're done at this point. Irrigation, scope off.
Say no, please. Thank you.
So, thanks though, appreciate your comments. Very difficult case, only because the herniation was very fibrous, very difficult to get out. It's been there a long time, a lot of scar tissue. All right, thanks for joining us. We're pretty much done. We're going to put a staple here and then get our patient back to recovery. Any questions?
At this moment, no current questions.
Go ahead. All right, Henry, let's end the stream. By the way, take a look at this. Can you see this?
Yes, we can.
All the pieces of herniation, plus here's a good sized one right there. So these are all little pieces of herniation. They make up the big herniation. I feel like we got 50% on each disc, which means there's still some herniation, but it's not going to cause any symptoms for him. All right, no, we're done. Keep going. Let's break everything down. All right. All right, thanks for joining us. We'll be back in 30 minutes for our